Greetings, my Chicagoans, family and friends. This is Charles Patton, your PC, the People's Counselor, sitting in for your favorite epidemiologist, Sister Ya Simpson. I am here representing the organization Tacts, the Association of Clinical Trial Services. And for those of you that has been following us over the last few months, we have been talking about health equities. All right, so we're going to continue this discussion, and this is a call-in live show. So you can reach us at 312-738-1060. So please call in, ask your questions, or join the conversation. Because as we know, we are still in some dire straits when it comes to accessing the necessary health care that we need. And I'm not just talking about medical care. I'm talking about getting quality food. I'm talking about having adequate housing. So it's a lot of things that falls into this paradigm. So we definitely want to continue this discussion. I know recently they had several town hall meetings throughout the city with Cook County Department of Public Health and Cook County Health Department, and they were having some discussions on how we can get the community involved and what is needed to make sure that we can get the things that we need. So hopefully you all will chime in and get involved in this process. All right, so once again, I want to talk about health equities, and let me show you a couple of our overheads. Now, if you look at this particular piece here, this is Tacts, the Association of Clinical Trial Services. This is who we represent. And our motto is pretty much with diversity comes a cure. I don't know if you guys can see that, but it states with diversity comes a cure and increased diversity in clinical trials. Okay, now, what do I mean by increasing diversity in clinical trials? For most of us, particularly people of color, we have been, treated and or, for lack of a better term, experimented on or treated with medications that's been actually tried on cultural others. And for a lot of us, those particular medications may or may not work. So I think that it would behoove all of us to start taking a very serious look at how we can get involved in this process. Because we know that a lot of us are genetically or predisposed to certain conditions, particularly hypertension, diabetes, sickle cell, so there are several conditions that affect people of color. And unfortunately, a lot of the treatments have not been tried on us because we have this particular innate fear, or if you will, this suspicion or this conspiracy-minded thinking around the healthcare system, and understandably so, because we all know about Tuskegee and the syphilis experiment. They got some other things around new eugenics and other things like that where they're trying to create perfect people. So a lot of us don't want to be that guinea pig, if you will, But if we are going to survive, and I mean have the best quality life, then we need to start thinking about how we can get involved in this process. I personally had to change my particular mode of thinking and started to get involved in several trials. One of them going on at UIC is called the All of Us study, and they're looking at genetic markers, right? Particularly for those of us who've had people diagnosed with certain types of cancers in our family, of course the hypertension, the diabetes. So they're looking at genetic factors and trying to get to what they call the precision type medicine or precision type treatment. So those things requires that we get involved in this process if we are going to get the best outcomes. Okay? So I encourage everybody to talk with your physicians. If you don't have a PCP, I encourage you to get one. I personally just had to change my PCP. We got a little too comfortable, and the man stopped listening. So we have to be clear that when we are working with physicians, we are the authority on what's going on with our bodies. They don't feel what we feel. They go on what we tell them. And we have to make sure that they're listening to what we tell them and not just giving us stuff based on what they feel is going to be correct on their particular level of learning. So I had to change PCPs. And subsequently, I wind up getting a new physician who understood what I was saying. And what really let me know that we was going to have a decent relationship to start. Of course, we don't know the outcome as of yet. But her comment was, it's your team. We just want to be a part of it. So when you get somebody that's responding to you that way, then you know you got somebody that's going to be working with you and not just trying to impose what they feel is best for you. Now, that's health equity, getting what you need. All right, so let's talk a little bit more about that, because a lot of times we think, when we went through the whole equality piece and civil rights and all that other stuff, it was about equality, right? Well, they get it, we want to get it. But equality ain't always the best thing, because what works for some people don't necessarily work for me. And that was actually proven a couple of years ago when I got sick on medications that they thought was some of the top line medications. Didn't work for me. So I had to let them know that. And of course, now we're having some opportunities to readjust and look at some other types of medication until, of course, I can make the necessary adjustments when it comes to holistic health. And once again, that incorporates not just taking pills, but also what you eat. Now, I am a connoisseur, if you will. I know most people like the word connoisseur, but I'm a connoisseur. And I generally indulge in things that bring pleasure. And I had to make some serious adjustments in the way that I was digesting my nutrition, because that all plays a part in getting optimal health. But let's take a look at this particular paradigm when it comes to what equality and what health equity really is. Now, I'm sure if you've been following our show, we have this diagram here where we have a group of people that's on bicycles. And you have one young lady who's in a wheelchair. She can't get on the bike because that's what they call equality. Everybody get the same bike, right? Then you got the big guy. The bike is too small for him. The young lady, the bike is perfect for her. And then it's too big for the little guy. But if you look at the next picture, now we have a bike that accommodates the young lady that's in the wheelchair. We have a bike that's large enough for the gentleman that's too big. And of course, the young lady was already fitted properly. And now we have a bike that fits the young person as well. Now, that's what we call equity. All right? Getting what you need. It's kind of like saying that we all going to wear a size 10 shoe. And for me, that would be extremely painful. So we have to make sure that we talk to our legislators, first and foremost, our physicians, the people that's supposed to be representing our best interests, so that we can let them know that this is what we need, not what you want to give us. Okay? So we want to continue to push people in the right direction. And like I say, be proactive. I did a presentation for a treatment group the other day, and we were talking about how we can take responsibility for ourselves. And I know that part of the language that the medical community is using is also incorporating housing into wellness, because that's a big piece. They also incorporated, as they say, let's use food as our medicine, because we know a lot of people are dying from getting wrong prescriptions or misusing or abusing some of this medications. So we have to make sure that we talk to the people that's responsible, or at least making decisions for us, and make sure that they are making the best decisions. And when they're not, then we need to call them on it, so that we can get what we need and not what they want to give us. Okay, so I am seriously encouraging everybody to call in or at least start looking at how you can get involved in this process because we know there's some major changes going on in this city and across the nation. You know, if y'all haven't heard, we still in the midst of an opiate epidemic. I am a substance abuse counselor by trade, and subsequently, this is starting to be somewhat of a nightmarish process. All right, when we start thinking about how we're allowing certain policies to dictate how much treatment somebody get. You know, I personally have been working with a lot of the insurance companies, which once again, that's that's one in the six in one hand, half a dozen in the other. But it's been a nightmarish process. Because they are dictating the tune and how much time somebody gonna get in treatment, not based on the history that's being presented, but it's based on profits, not people. So we're gonna have to continue to advocate and fight for this process because if we allow these companies to continue to do the things they do, then we're gonna continue to see a very high recidivism. And I'm sure all of us can think about somebody that we know in our family that's been afflicted or touched by substance abuse in some kind of way. I know I met a gentleman today who was suffering from throat cancer as well as chemical dependency. I got a couple of young guys who was unfortunately got caught up in this opiate epidemic. And this is crossing racial lines. So it's not just about people of color. It's about us making sure that we get policymakers in position that will continue to fight for us. That will continue to give us the things we need. Oh, hey, it looks like we got a caller. All right, well, welcome, caller.
Yes, and you know what? I always enjoy your show. You give some extremely important messages to us. Listen, I hope everybody could hear me. I had a stroke in March. I couldn't speak.
I'm sorry to hear that, but I'm glad you're still here. Yes.
That's the most important thing. I could work on my speech, but you can't work on anything if you did.
That's true.
It's a great day to be alive. But listen, I heard you talking about teams, and this is God's truth. You need to have a team that take care of yourself. And you omitted one of the other most important team members that I think are, and that's your pharmacist.
Yes.
I have a really good relationship with my pharmacist. See, they know the medicine.
Yes.
They show what I shouldn't take, what I need to take, get in contact with your doctor, Steve, and find out. And many times they have told me things was true that I brought back to my other team. They said, see, let's try this then. So, again, God is the Almighty. I mean, He's
right.
doctor, man to man. But an important person on your team is that pharmacist.
I agree with you 100%. And I know I tell my pharmacist all the time, she is truly my legal pusher because you're right, she has been instrumental in making sure that some of the medications I get don't interact with some of the other medications that I get.
That's right.
Yes,
Listen,
sir.
let me get out there so I can hear your response. And thanks for taking the call.
Oh, thank you for calling, sir, and I really appreciate your input. All right. All right, well, thank you. That was a very inspirational call, and he is absolutely 100% correct. I did omit one of the team members, and that is your local pharmacist. I have a very good relationship with my pharmacist. I actually go over to Target. This is not a plug, but the young lady that dispenses the medication that's being scripted has been very instrumental in letting me know what works and what doesn't work and what shouldn't be used together. I had an experience working with one of these medications, and I think it was hydroxyline or one of them other blood pressure meds, right? And I had a pharmacist tell me that you shouldn't be having this medication with dairy products. Now, I didn't know that, right? But I go to the counter, I order my medication, and I also have a chocolate bar, as we already know. We already talked about that nutrition thing, right? But at any rate, the pharmacist looked at me and he said, you know you shouldn't have this medication within 2 hours before, 2 hours after eating dairy products. I'm like, no, I didn't know that. I was using the candy bar to coat my stomach to take the medication and didn't realize why I was having all these muscle spasms. But thank you again, caller. That was a very important piece. So not only do you have to have a great relationship with your PCP, you also want to work with your legislators. And of course, if you are on medications, develop a relationship with your pharmacist because they definitely know the medications and they can assist you. The ultimate goal is to try to get off of them. All right? So we want to get back to talking about food as medicine because that's another big piece. You know, I was happy to see that they finally got a full-service Jewels over in the Woodlawn area, which I hadn't known. They hadn't had one in over 40 years, you know, so that's important stuff. Because what we know is that we had heard for years about these food deserts. You know, that's been affecting certain areas. And then you got a lot of people that's going to these corner stores, buying stuff that's on the verge of being rotten. All right, so I really applaud the community for pushing to get this particular service in that area, and because it helps us to access some good nutritional input and stuff that we need to help us stay healthy. So once again, let's take a look at one of our overheads, and we talk about another paradigm when it comes to looking at health equity. All right, now this one here, this demonstrates the boxes. You got three people. You got a tall guy, you got a middle-sized guy, and then you got a small guy, right? Everybody got one box. Now, look at that. Can the little guy see? Of course not. Then you got, when you look at the equity piece, the tall guy really didn't need a box. The middle guy needed one box, and the shortest guy needed two boxes. That's health equity. That's what I'm talking about. We need to make sure that we push people to get what we need. So not only do we need to get another Jewels in the community, because I just heard they done closed a few CVS's around the community, particularly in communities of color. Not only is that taking away access to certain beneficial things that we need, and now we have to travel further, which is a burden for a lot of people. Right, because we didn't even talk about the transportation factor. So those are some things that we need to push our politicians to talk about to make sure that we keep fighting to get the services in our community. Because not only with them stores closing, did they take away needed materials and needed things that we needed to get for our households and our health, but it also took away jobs. It also took away revenue from the community. And we already know, like I said, we in the midst of several different crises here as far as opiate crises, food shortages, access to resources. So these are things that we have to get with our legislators about. Okay? Now let's look at another piece. And this piece here is talking about violence as a disease. Now, if anybody had an opportunity to make one of the forums that was hosted throughout the city, and I think the last one was May 9th, and they were talking about the Cook County Health Forums. If you had a chance to make one of those forums, then we know that violence is plaguing our community. I don't know about y'all, but I'm an avid news watcher, and it saddens me when I see a lot of the horrors that's going on this in our neighborhoods with people getting shot unnecessarily, particularly young people going to parties, people walking down the street with their babies, you know. So we are trying to have a conversation where we can discuss the impact of violence as a disease. Now, of course, according to our epidemiologist, Sister Yah, most diseases are contagious. This particular conversation is about the effect that violence has on a group of people and individuals. And there's some systemic causes for a lot of these conditions, generally around economics, people having some mental health issues that's not being appropriately addressed, not to mention substance use. All right, so a lot of these are precursors to some of the violence that we see. So we have to start looking at all of these factors and then start having discussions about how we can address some of the violence in a very effective way. Because incarceration ain't the key. Gun legislation ain't the key. We have to start to help people liberate their minds. And we have to start helping people to address the mental health conditions and the physical health conditions that they're suffering from if we are going to address the violence that's going on in our community. As I stated, I am a substance abuse counselor by trade. And I see a lot of people who have been disenfranchised, displaced, meaning that they're homeless, they're living on the street, they're in and out of shelters, and I don't know about you, but if I get hungry, I'm going to do something. And I truly like to think that we can be somewhat compassionate and not so punitive in the way that we address people. Because there's some, like I said, there's some systemic causes to a lot of this. Now, don't get me wrong. I believe in accountability. But we also have to look at what's underneath that. I mean, we all heard about the iceberg paradigm. A lot of the stuff that we see on top ain't a fraction of what's going on underneath. So once we start to address the root causes of some of this violence, once we start to address the root causes of some of this substance use, once we start to address the root causes of some of this mental illness, then we can possibly make some effective changes to give people the things that they need. And making sure that treatment is available, not just based on what the insurance companies is willing to provide. As I was stating a moment ago, this has become a nightmarish process, when it comes to advocating and fighting for clients to get 2 and 3 days in a detox program or to get 15 days out of a 30-day program. And we already know that those particular amounts of time is not nearly enough if somebody been using substances for 15, 20 years. If they are disenfranchised, if they are going back into the same environment in which they come from. It's hard to heal in the same environment that made you sick. So we have to truly make sure that we talk with people, that we get these legislators, we start talking to these insurance companies, because I don't know about y'all, but I wrestle with my insurance company all the time. If you've been to the doctor lately, and you've seen some of the prices that they charge, then you and I both need to get down there. We need to be walking the picket lines. We need to be down there campaigning. We need to be grooming candidates to be put in policy-making positions. There's a whole host of things we can do if we're talking about trying to save our families, save our neighborhoods, save our communities, and ultimately save a nation. Okay, so we have to start looking at all of these particular components. All right. Now, what is meant by violence as a disease? Behavior involving physical force intended to hurt, damage, or kill someone. Strength of, we're going to skip over that bill, saying savagery, cruelty, sadism, barbarism, bloodthirsty, ruthless, inhumane, heartless, pitiful. These are some of the terms that we use, but we don't look at what's underneath that, okay? And of course, law, the unlawful exercise of physical force or intimidation by the exhibition of the unlawful exercise of physical force, okay? That's a mouthful. All right, so truly, I encourage everybody to find a way to get involved in your area. It was suggested by one of our mentors that you get within a 4-block radius of where you live, and you walk those blocks, and you see what's going on, and you find out who's running those shops. Okay, and you find out who owns those houses, and you find out who's making the decisions about what's going on in that community, your older persons, and you talk to them. You let them know when things ain't right. Okay, and with that being said, I want to thank you all for your time. And I hope that we will be able to do this again next month, and I encourage more people to call in. And with that, This is your people's counselor signing out and wishing you well. Peace and blessings.